Hello, and welcome to Memorial Healthcare System Skype Chat, where we'll be bringing you helpful tips from specialists throughout the system about how to keep your family and yourself safe and healthy during the COVID-19 pandemic. Today, I'm excited to talk to our very first guest, Dr. Ashwin Mehta. He's the Director of Integrative Medicine at Memorial Healthcare System, and he's going to be talking to us today about self-care as it relates to healthcare professionals. Thank you so much for joining me today, Dr. Mehta. How are you doing?
My pleasure. Thanks for having me on. I'm doing well. We're, taking maximum precautions and really just taking it day by day here. So
Right. It's a
doing the
new
best
normal.
we can.
Yes, it's a new normal. That's what we keep saying, just trying to adapt as best we can. So, first up, healthcare providers. Often they're of the mindset that they should give of themselves no matter what the situation they're facing. And often, unfortunately, it's at the detriment of their own well being and health. This phenomenon is not exclusive to anything that's happening now, but it's fairly typical even in normal times. So, Dr. Mehta, my first question is, how does the COVID-19 crisis impact the situation, and what makes it so different for healthcare providers?
Really, there's a lot of uncertainty right now. And I think this uncertainty is what is fueling the anxiety and fear about this current crisis. When I'm counseling people regarding fear in our integrative medicine clinic, it's usually in the context of cancer survivorship, and people are concerned about whether their cancer is going to come back or not. And, the way I describe this spectrum of anxiety to them is that on one end of the spectrum, there's reasonable concern.
Right.
There's really founded and acceptable worry. On
Mm-hmm.
the other end of the spectrum, there is disabling and paralyzing fear.
Mm.
And so to the extent that we can actually make sure that our behaviors, our patterns of thinking, our practices help us end up on the reasonable concern end of the spectrum, it's really important, to not let this fear grip us and grab a hold of us. It's also important to recognize that fear is at its very core our innate survival mechanism. And to
Mm.
a certain extent, it's even useful.
Yes.
There's a lot that we still don't know about this virus. In the midst of this pandemic, people have lost their lives. People have lost their livelihoods. Children are at home and learning how to do school through the internet in a very different environment. There are likely increased feelings of loneliness and isolation during this time. So there's innumerable changes coming at us. And in the midst of this uncertainty, we really need to acknowledge our fears and anxieties first and foremost. Practices like mindfulness and meditation can make us more aware of our emotions so that we can more objectively decide which sentiments are lending to behaviors and patterns of thinking that are constructive and which are not so constructive. In the context of this innate survival response that is fear, how can we anchor ourselves to handle these challenges more adeptly? And at the same time, we need to identify certain health practices that keep us feeling more grounded in this time of uncertainty.
Certainly, and we're going to talk about some health practices that healthcare providers can take in a little bit. Next question is: do you think the healthcare workforce is going to come out of this situation stronger, or do you feel there'll be a significant negative impact in the end? Why and how can we influence our destiny?
Well, there will be transient negative impacts for sure, and we're already beginning to kind of experience that firsthand. But I have every confidence that we will emerge from this situation more unified as a team. I'm really encouraged by the well-planned and robust response that we've worked hard to put together here at Memorial. I'm inspired by all the well-orchestrated efforts from very senior leadership, top down throughout the entire health system. How we've allocated and reallocated resources, including personnel, space, personal protective equipment in order to prepare. It's really a testament to our organization's culture of collaboration and how we can really come together as a team. I can give some examples. In our integrative medicine clinic, we've switched to 100% telehealth.
Yes.
So we're using these wonderful technologies to connect with our patients and to kind of maintain a rapport with them when there's a lot of anxiety about health. To provide them an opportunity to answer their questions during this challenging time. I hear that physicians from our cancer center have volunteered to team up with our Memorial Primary Care group in order to facilitate testing at CB Smith Park and assist with the drive-through screenings for the virus. We've reappropriated our graduate medical education auditorium, to prepare for potential overflow from the hospital. So it's really just an amazing coming together that I see. Another advantage that we have as a health system is our focus on wellness and resilience. Resilience has been a very important theme throughout this whole year, and I think this pandemic actually provides a very interesting arena in which we can test firsthand our resources for wellness. Our Physician Wellness Committee has come together and provided a list of resources that physicians can use, and we're going to be making that available more broadly to the rest of the health system. So we're really taking a proactive approach to health and wellness and resilience more broadly. So I'm incredibly encouraged, and I think that we will emerge from this crisis even stronger as a team.
I 100% agree with you, definitely. What recommendations do you have for staff working extremely long and hard hours? They're covered in personal protective equipment. They're worrying about their own ability to stay strong as well as their families.
So unmitigated stress, dehydration, and lack of sleep are probably very significant risk factors. All of these three have been shown to kind of weaken our own immune response. So first and foremost, just the same thing that people encourage when you have the common flu or a cold, and that is rest and hydration. If I had to write a provider's a physician's manual for any of those people who are first line boots on the ground, taking care of people in the midst of this crisis, the title of the manual would be Fitted In. You have to fit in that self-care. You have to fit in, the hydration. I have a very large water bottle. I count how many times I get through it every single day. I have a daily water intake goal for myself. Nice. I think it's important to establish that. Yes. As a general rule, if you take your body weight in kilograms and convert that over into ounces, that's a bare minimum for how many ounces you should be drinking on a daily basis. Sleep, I'm a sleep medicine expert by training, so getting enough sleep is imperative. Yes. And really, asking for help whenever we need it. I've just seen an outpouring of assistance. People are really kind of working together in cohesion in the midst of this crisis. And so, let's not be afraid to ask for help when we need it, and also to kind of preemptively address our needs, to kind of anticipate our own needs. A really great example that I heard from our Memorial Regional ER is Dr. Randy Katz, who is the medical director of the emergency room at Memorial Regional. He and his wife actually put together a impromptu fundraiser, and yes. I think they raised over 5 figures to get food for the ER staff. And this is how we can preemptively address our needs and kind of proactively address these potential stressors to mitigate them before they become overwhelming.
Yes, I definitely agree. That was a really cool fundraiser that they devised, and it also helps local businesses because they provide the food to the frontline staff. So Absolutely. Thank you for mentioning that for sure.
Absolutely.
What exercises would you recommend for staff to help find the silver lining or overall meaning of this event in order to give us hope for the future? And of course, when we think of exercise, sometimes we just think of, physical, but please speak on the mindfulness meditation as well.
Sure. I think really broadly, when we are kind of sheltering in place and at home during that downtime, this nature has a way of slowing us down when we need to slow down, both individually, when we succumb to a flu, or societally more broadly. So I think that this is a really great time to look at our practices, our routines. And if there's any positive health behavior that you've been really wanting to incorporate into your daily routine, they say it takes 3 weeks, to establish a habit. well, this is a really great time to, to think about what habits we might want to incorporate into our daily routines. We will invariably, inevitably ascribe meaning to this experience. That's part of what makes us human.
Yes.
That's inevitable. Ascribing meaning to our challenges, our fears, and even our traumas. It's part of what makes us human beings. But as far as exercise is concerned, I think that really you got to fit it in, and don't let the perfect be the enemy of the good. I really, the whole idea that we need a gym, in order to exercise, I think that we really need to revise our mindset in that regard. I
Definitely.
think that, we also need to reflect for a moment about what types of exercise we enjoy doing. Because ultimately we're good at what we like and we like what we're good at. It's just, again, part of our nature.
Yes.
But I think that it really, really, um, getting a bare minimum of 30 minutes of moderate intensity exercise 5 days a week is actually a good starting point, and that can be a brisk walk. It can be, any household, routines that you may have, and also a lot of companies are making their materials available online for free
Yes.
over these next 30 or 60 days. So that's part of our resource list that we've put together as within our physician wellness committee. And so keep a lookout for these types of resources. We'll be sharing them, and we also want feedback from other people. What other people might be doing. Hey, here's a resource that is looking at yoga. This is a resource that's making mindfulness and meditation free for the next several days. There are many different resources out there. You may need to experiment with one or more in order to find ones that really resonate with you. It's less about what modality you use and more about the consistency with which you use it. That is really key. So, if you're going from couch potato to some moderate intensity exercise, that's a plus. That's really going to be important for your immune system, your physical and mental health.
Definitely.
If and mindfulness also, there are so many different resources out there, whether when it comes to apps that you can use, and online resources in order to really strengthen your practice, and really utilizing this sort of telecommunity that we're developing gradually, utilizing all of these teleconference methods that we've been utilizing in the context of our daily operations. Really
Hmm.
using them for self-care also is important. I've heard of people who are doing everything from virtual happy hours to yoga sessions,
Yes.
meditation sessions, exercising together. Really maintaining that sense of community and accountability in order to maintain these behaviors as well as we can during this time.
Right. Uh, just piggybacking on what you said, I know the word of the day today is physical distancing, not social distancing. So I think this time has kind of forced us to be really innovative and creative in how we socially connect virtually while
Right,
physically being distant from each other. So it's definitely brought about some really creative and innovative telecommunication and socializing for sure. Last
right.
question. Is there a role for gratitude at a time like this? Obviously, I think everyone in the world right now is extremely grateful for healthcare providers. They truly are on the front lines. They're putting themselves at risk. What is the role for gratitude, though, at this time?
Oh, there's a tremendous role for gratitude. Eckhart Tolle says that if there's one prayer that we say during our lifetimes, in order to really find that contentment and inner peace, if there's one prayer, it ought to be thank you. So this practice of gratitude, I've woven it into our morning meditations. We have a Wellness Wednesday morning meditation. It's a 15-minute meditation between 8:15 and 8:30 that I share with the entirety of the health system. And gratitude is a central pillar of that practice. Just taking a few a few moments each day at a time that is convenient for you in order to express gratitude for the people in our lives, for the support network that we have, for our friends, our families, our coworkers, even, and all of those people who are coming together to help us surmount this crisis. I'm grateful for the fearless scientists, all of the people who have been, conducting research internationally that give us some ideas with regard to what's going to work in order to get through this and help our patients get through this. So an outpouring of gratitude is a great practice, and for those individuals who really enjoy journaling, really
Mhm.
writing that down. It's a really nice practice to put pen to paper and just reflect for a few minutes about three things every day or every evening before you go to sleep. What we're grateful for, and that practice of doing that day in and day out, it actually has been clinically proven to improve our happiness and our feelings of contentment. So there's a tremendous role for gratitude in this, and again, I think that we're going to come out even stronger than we went into this.
Thank you so much. Is there anything else you'd like to add before we end our Skype chat?
I think that it's just a reaffirmation of our routines. And sometimes when we are in the trenches of healthcare and incredibly stressed out, really creating a space when we come home is a very important practice. So I've heard a lot of people just share this, very, very spontaneously. People have come home, they've shed their scrubs. The scrubs go like directly into the washing machine. They take a shower, and then they kind of come together. Then their families are allowed to interact with them. So there's that little space where they're allowed to decompress and de-stress after a very stressful day. I think that that's a really nice practice. We can all establish our own little, coming home routine, so we leave that stressful energy, where it needs to be outside of the home, and we can really connect meaningfully with our loved ones at home. And using a devotional practice or a mindfulness meditation as part of that kind of, coming home decompression routine is a really nice practice. And remember, rest, hydrate, meditate, exercise, and really ask for help before you might need it. If you just keep these simple principles in mind, I think that we're going to do just fine during this.
Great. So rest, hydrate, meditate, and ask for help when needed.
You got it.
Great advice. Thank you so much, Dr. Mehta. We really,
My
really enjoyed talking to you today. Stay healthy and stay safe.
You as well. Thank you.
Take care.